Hello, I'm Robert, and there's been news recently about the WHO, the World Health Organization, warning about all the trolling and the mistaken advice and people who claim to be experts you get on the internet telling us all sorts of crazy things. And if you want to know what the truth is, then do follow the WHO. They are experts in this. They have to deal with about 200 epidemics every year. They're, there's no way that the Chinese are pulling the wool over their eyes. They know what they're talking about. And then you get someone on YouTube, there's one being shared recently, where someone said, "Oh, I was in China recently, and I taught doctors English, and then I've got some doctor friends who are still in contact with me via Twitter or whatever, and so I know all about what's happening in China, and the WHO are having the wool pulled over their eyes because I know." And I mean, that's don't listen to these people. They don't know. They just got a lot of confidence in their own abilities to discern what's going on, which they think is better than what the WHO can do with all their expertise and all their experts and all their contacts and all the people they know. So the WHO is the other people to follow, and they're doing these daily briefings, and they're also on Twitter, and then I've got some more sources here. So there's those two pages, and then this is if you want to keep an eye on the global cases, and I'll do that there. I'm going to talk about that in a minute towards the end of this video, after showing you some of the sources. If you want advice as to what to do, then I've got that on this page here. I'll put a link to this in the description, so you can then find everything else from it. So how do I protect myself? These are the WHO guidelines, which most of you probably know by now. Avoid close contact and frequent hand washing. And the CDC is slightly more detailed. And then there's a medical overview from Lancet. And so and it praises how quickly the Chinese have responded. And these are experts again talking. And the lessons from the SARS epidemic, where they took ages and ages to do anything, and for a while it was even a state secret for a week or so before anybody knew about it. And they've just totally turned around. And the WHO tell us that China had a system in place to detect unusual epidemic and unusual numbers of a cluster of pneumonia cases that are unusual. And the very moment it was triggered on the 31st of December, they notified the WHO about it. And then one doctor on the 30th, and I think there were 8 altogether, they started saying, "Oh, we think we found something a bit strange going on." But so WHO comment and point out that there's often people notice things on the community level, but it's not actually triggered to an alert. And just me talking as sort of independently of them, just saying that there's obviously a lot of caution about SARS in China, and how many times have doctors done this when it wasn't SARS, it wasn't a new virus or disease? People don't seem to talk about that. So there may have been previous there. Anyway, whether or not, it was only one day before, and it just hadn't quite reached the level where it was an alert for the WHO, but some doctors were beginning to wonder, and then so he shared this to other doctors. So anyway, you can find all the medical details here. I've looked them up. I've got links to the right places. These are quotes from high resource, highly reputable centre. This is resources for clinicians. In fact, that's where I got it from. The Elsevier resource for clinicians. That's the CDC resource page, the Lancet Hub, where you can find all the medical papers. So especially if you are a clinician or doctor or nurse yourself, then these can be useful places to keep up to date. And the medical reports are well worth looking at if you are reasonably used to reading academic papers. But of course, bear in mind that whatever paper you read, it's cutting edge stuff. For instance, there was one saying they thought it came from snakes, and that actually was in New Scientist and widely publicised, but then another paper comes along and says no, it's not. We don't think it is. We don't believe you, as it were, because your evidence, though it seemed pretty good, if you look a bit more closely at it, it's not as good as it seemed. So you've got to, if you're reading medical papers, beware of that. So yes, what else have we got here? So, and then this is quite useful. If you want to actually research and find details, if it's a number of severe cases, then you find them here. You go to search around, you just find the past 24 hours of the Chinese state propaganda news, as it were. And so of course there can be lots of propaganda there, but on this, they are accurate. All the experts are saying they're not exaggerating, they're not understating, they're stating exactly what they found. And it fits all the models and everything. So that's what I want to talk about next, because there's so much conspiracy going around, and it's not true. So these are the actual figures that we see, and let's remove me from the screen for a little while, if you could just see what's there. So as you can see, it's nearly all in China. Even though it's 812 deaths, I mean, compare that with the population of China, or even Hubei province, and it's not such a big amount. And you're very, very unlikely, even if you're living in China, if you're living in Hubei province in Wuhan, it's extremely unlikely that this will be the reason you die, if you die. Many people will be dying of flu, for instance, and of accidents in the home, just falling down the stairs, and car accident or heart attack, or later in life, and things like cancer and heart attack become significant factor of the total deaths. So even if I was writing this in Wuhan, I would not feel that I need to evacuate to the UK. I would just take the precautions, as they say, to wash my hands and keep a distance from people, and my chance of getting this, I'd be thinking like, well, it's more important to avoid getting the flu even in Wuhan. So the main thing that's a problem with this is because it's new and it's expanding, so they've got to try to contain it. So I want to talk a little bit about that. It actually looks rather more optimistic than people often make it out to be, and this is to explain why it makes sense. So the WHO are not saying that they're concerned terribly about Chinese. In fact, the Chinese think that they're on the point of containing it if they can keep up with these measures, and the WHO are in agreement with them on that. So you might look at that and say, look, it's increasing all the time. Why does that look like it's being contained? Well, the thing is that if it was growing like exponentially, then we'd have a doubling time, so between there and there. For instance, between there, 65, and there, 2000, then it's doubled. So it doubled in 2 days. Next 2 days, it's again doubled. So if it was really a doubling one, the next 2 days you would go 8,000, so it would be up there, but instead it's 6,000, so it's just going up another 2,000. So if it was really exponential, it would be up there by then. And then here, it would be 9,000, it should instead be 16,000, way up here by then. So it's clearly not doing what it was at the very beginning. It's not kind of doubling, going up like that every 2 days. And someone said in the House of Commons in the UK, it's doubling every 5 days. Well, you see, that's what happens. If it is being contained, it'll start off doubling every 2 days, then every 4 days, 5 days, 10 days, 20 days, and just gradually gets slower and slower before the next doubling. And so that's the time until the next doubling is what you look at, and how that is changing. And to me as a mathematician looking at that, what I see, ignore the last point, because you're going to have a few more deaths, a few more cases, and before the day ends. But what I look at that from there to there, it looks pretty much a straight line. So that is what you expect in the middle of an outbreak. So the start is growing exponentially, then it's like a straight line, and then it'll flatten off and it'll level off. Now sadly you can't just deduce that from the curve. You've got to know what's actually going on, because you could get a second outbreak, and it could suddenly start going up again. But certainly at the moment it looks as if it's been contained in China, and it might start levelling off soon. Because what you've got to bear in mind is, again, that all the extra restrictions, so it's from about here that it start becoming level, all the extra restrictions come in there, but people then, they will, some of them won't develop symptoms for 2 weeks, so that's 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and 12, 13, 14. So about here, then we're just getting to the end of the people, of the symptoms of the people back there when the extra precautions were added. So all this has just been, I mean, at least some of that has been people who were infected before they started doing the extra restrictions, but then started getting a bit of a fever and turned themselves into the local hospital. So it looks very, if you kind of put a mathematician's hat on or epidemiologist's hat, the WHO or the Chinese people, they're the ones that are saying this, and they're saying it looks reasonably contained in China at the moment. And the WHO say the Chinese have given us a window of opportunity to stop it by their very prompt, the WHO haven't got any data about what happens if you quarantine a city, because nobody's ever done that before in modern times. So WHO are doing things and then stopping all public transport and things that have never ever happened before. So people will be doing research papers probably on this for decades to come as to how effective it is quarantining a city. But it does seem that what they're doing is, on the evidence of this, it does seem that they're making progress. And then if you look at the people outside China, so I'm going to first of all look at what's positive, and then I'm going to look at what some of the problem is still, and why they declare a global health emergency if that's the assessment. So there's a reason for that. So now this is the case outside China, and you see it's pretty much a straight line. I mean, that's again with my mathematician's eye on apart from that last little blip, which I'll explain, then it looks pretty much like a straight line. And that last little blip is, so if it was going to start spreading in some other country, then you'd expect to get a little curve going like that at some point, probably doubling every 2 days or something, or doubling every few days, 5 days or something, and that would very, very quickly get to thousands, within a month or 2. So what we're not seeing that, and that might look as just a start of a blip. What this is, so if you look at it, is that the beginning of a blip? It's not a very slight suggestion, could that be the beginning of a blip? But it is a blip, but it's a blip of 61 people in a cruise ship. So 61 people have caught the virus in a cruise ship that's being held in quarantine off Japan. So this is not going to get out of the cruise ship. So there's a little bit of a blip of a local infection, but it's spreading inside this ship. And there's 1,000 odd patients there, and not patients, 1,000 odd passengers. Most of them haven't got it. They're keeping them all separate from each other, and as much as possible, and just occasionally allowed up on deck for a bit of fresh air in separate parties. And they're going to be quarantined until it's all over. And we probably get quite a lot of data about, a small outbreak of these 61 people. So why then are you in any danger in a plane? Well, not really. This is the first time. I think this is the first time where it has actually been spread person to person in an international transport. You're not in the plane for long enough, and you haven't got enough close connection. It seems to require very prolonged connection with someone, or very close, contact with secretions. So that's the prolonged contacts. And so you're advised to keep well away because of coughing and sneezing. But it seems that even if you're sitting next to someone who's coughing and sneezing for a plane journey, they test the people who are within 2 meters and check them and follow them up and so on. It doesn't seem that it does seem that it's not very infectious yet. And the coronaviruses, they mutate very, very slowly. Despite being a kind of virus you'd think would mutate quickly, but they've got some extra ingenious error connection that comes in. I think using another virus or something. I don't know. I don't understand the technical details, but they've got this error connection, so they're not very likely to mutate. But if they are over a short period of time, over a long period of time, then generally diseases, there's no point at all in killing your host if you're a virus. The more you can keep your host alive for as long as possible, then the better. So viruses tend, long term, and that's what they want to do. And some of our common colds start off as something like this possibly. There are, I think, four versions of the common cold that are coronaviruses that must have entered the human system. So not all common colds, just 4 of them. They entered the human system thousands of years ago, whenever it was, and they're now completely harmless. You just get a bit of a sniffle, and you're not likely to die at all of those. So, but that would be very long term. That would be over thousands of years. That's what would happen to it if it were to spread were to spread. So we'll talk a little bit now about the problem of the epidemic problem. Where does this go? So this is why they declared a public health emergency. Africa and South America, which thankfully don't have any cases yet. So the WHO, when they declared the emergency, weren't particularly concerned about, in terms of pandemic and epidemics, of course they're concerned about all the people who are dying and so on, but not just like any other epidemic. But in terms of becoming a pandemic, they're not concerned at the moment. They're not concerned so much about China because they're keeping it well contained. They're not concerned about these places like Norway, Sweden, UK. I mean, they're going to keep it very well contained. And so yes, people ask, it was expanding so quickly in China. Why isn't it just rushing off and creating lots of cases in UK? Of course, the reason is that we have all the experience of the Chinese doctors, and we have these gene sequence. We actually have tests where we can test for it straight away, within a few hours to a day. And that's why it's not spreading. And we know what to do. We know that back then didn't even know that you had to have protection for the health workers in the very beginning. So, but the problem in Africa is that places like Sudan, for instance, then they have, they might come to, I'm not geography in that brilliant. I think that's Sudan, and that's the central, that's the Congo, and then Somalia down here somewhere, on these coastally things. Anyway, is that Somalia? Anyway, these are places very poor health care systems, and and in fact in Kenya, most of these countries, they just can't. They couldn't even test them. They sent them off to South Africa, to India. So India's got one case, but it's very strong medically, even though there's a lot of poor people. So the two questions you've got here: can you contain it straight away? And then India can do that, and South America apparently can. If you just got a few cases. Africa is a serious difficulty of it just even containing a few cases, just even like 1 or 2 cases in the country, in Sudan. And do they have the health facilities to detect them first, and also to isolate them, keep their medical workers safe? So that's the WHO's top priority, and they've sent thousands of protection gear for the health workers to these countries where they just don't have it, and and sending them tests. So they've sent 250,000 tests to these poor countries, which they can use. Then there's some training already for flu centres in Africa, and so that is what they say is their top priority. And they asked for a fund of $625 million for their vital work of stopping it spreading in Africa. And these are the places with poor health systems or intermediate level health systems where they need some help. And they have so far, in just one day I think, they've received, 2 days maybe, I'm not sure, they've received $100 million of that $625 million that they need to keep going for 3 months. So, and they say they're more on the way. So certainly it looks as if they're going to be able to put in the money that's needed to stop it in Africa. And this really everyone's attention should be on Africa and what we can do to stop it spreading there. Because, just a couple of facts. Like for instance, in Sudan, then that Sudan in its last year had, and said the Congo has had 2,000 deaths from measles, I think it was the Congo last year, and the Sudan had some cases of childhood diarrhea, children dying of diarrhea in poor areas with bad drinking water. So even though there's been lots of work and there's been a huge reduction in child mortality in the last decade or so, there's still some parts of the world where children are dying of diarrhea, which they simply shouldn't, not in our modern world. And that's happening in Sudan. And so that gives you an idea that if you start spreading in the rural areas of Sudan, then you definitely would see a big blip here. That's what they're concerned about. And that's why then it would just start soaring like it did in mainland China, and it would be just about impossible to stop. So it would just go, going up like that, and it would be tens of thousands within a month or so, a month or two. So that is why they say absolutely important to, because China just doesn't have they just don't have, not China, they don't have the resources of China. Look how hard it was for China to contain it. And they just simply, they couldn't quarantine a city, they couldn't, and the death rate would go up. So at the moment the death rate is about 2%, but if you're in places like that, I mean when they get towards the end of their life, the ones that die, then they're put on a ventilator, first they get oxygen, then they put on a ventilator, respirator, and then half of them survive that, and the survival fraction is going up. So if you're in Africa, then how many places in rural Africa would you be able to get health care with a respirator? Just that much. I wouldn't think very many. So surely the death rate would go above that 2%. So that's why it's absolutely important, very important that it doesn't get into Africa, and that would spread country to country. The borders are very porous, and then it would be like trying to eradicate smallpox all over again. So but we do expect to get a vaccine. We don't. Some people think, you get the impression that you need to know where it came from. You don't need to know where it came from in order to get the vaccine. The vaccine requires, with modern techniques, you just need the sequence of the vaccine. You need to have, ideally you have the virus, ideally the virus itself, and then you can use that to make a vaccine. You sniff a little bit out of it and you sort of do stuff with it, and the idea is to try and get the cells in your body to think that they've been infected with the virus and produce the antibodies to it, when actually it is a completely harmless thing that can't replicate at all. It's just sort of fooling your body into thinking it's the virus. So so what they have to do is to test people with this, because making this with modern medicine, you can make a vaccine in a day. Some of them literally did do it. At least one team did it in a day, once you've got the materials that you need to make it. But to test it, that takes weeks, months, and normally years, and they're going to try and speed that up and see if they can finish the first large-scale testing at the end of the summer. And if they can, then they'd probably start by vaccinating healthcare workers as being most important, so they don't spread it to others. And then vaccinating, they would only start vaccinating millions once they know that it's very, very, very safe. I suppose close contacts, they surely vaccinate them, and things like that. So that's the situation. Oh yes, just one other thing I want to talk about. See the total deaths and the total recovered. You see, I've been telling people that this total recovered is going to keep going up. Total deaths, I said a few days ago, expect that to reach 1,000 easily, and it may reach 2,000 or 3,000. This is just based on very, very simple figures. I just looked up how many severe cases, and then about half of them are going to die, probably. then add that to total deaths, and that was going well over 1,000, and probably a little bit less than half dying as with better medicine. So I mean, please don't panic if that reaches say 3,000 or even more, the way it's going, before it levels off. It's sort of, I mean, if you go back to this curve, then you've got the exponential at the bottom, then you've got the straight line segment. That could give you quite a while, and for long as that's growing, it's adding to the deaths, and then it starts leveling off. So, depends how long that continues. But it's more or less straight, and so straightening out more, and then leveling off. So you can expect quite a few deaths. I imagine it's hard to estimate, even if it is properly contained. I can't find an estimate. Now, totally recovered, and go back to that page again, explain why the totally recovered. Then these would come recovered now. That would be up to 1, 2, 3, 40 days ago. 4, 5, 6, 7, 9, 10, 11, 12, 13, 14, back there. So back then, there were only 2,000 cases. So some of those cases will be totally recovered now, after 2 weeks. So, and some will be from a bit later than that. That's why it's more than 2,000. But really, you can't tell from totally recovered the number died so far, then that's much higher. You don't just divide one by the other to get the health rate, the death rate, or anything like that. And the death rate is like the fraction of all that of the ones, but even that is too simplified as well. And some people live for 41 days, which I think was the largest I've seen, from first symptoms to dying. So that's that. So expect that number to keep on going up and up and up and be thousands and thousands. Eventually it's going to be 40,000. Certainly it's going to reach 40,000 for sure, because that's the number of cases it's surely going to reach 40,000. So you won't get 40,000 recovered eventually, because only 2% die, and it's all. So yeah, I just want to talk quickly about this conspiracy idea that so the idea that the Chinese are covering up a much higher death rate. That is not at all, that's just not remotely possible. Oh yes, I haven't shown you situation report, so that's a good time for that. So this is the situation report. These show the deaths, not the deaths, the cases outside China and when they were first detected. So this big blue spike here are the people in that cruise ship that's being quarantined off China. So don't worry about that, because none of these are going to infect anyone else. And they're reducing the amount of them infecting each other as well. And out of these total cases, I think it's getting up to 300 now, is it not? Then out of all those cases, whatever the last figure was there, no, not that one, 343. So out of those 343 cases, then I think there's only been 2 deaths so far, and this has been another one since then. You expect that 2%, then you'd expect six deaths out of those, so probably eventually 6 people will die, maybe more. But if it's not, but we're detecting lots of people without very much symptoms, so if it's based on those, if there are more of those than they're accounting for in China, the death rate might well be less than 2%, because we might be detecting much more than they did, because we're being much more thorough than they did early on. Anyway, we'll discover eventually. So, and I was just going to explain about the vaccine. So, I've explained about the vaccine. So, so this situation at the moment is looking okay. It's on the cusp. It's being contained. We've got this window of opportunity, and it doesn't look as if it's turning into a pandemic yet. It's very much an epidemic in China, which looks as if it may be being contained. And your personal risk is absolutely minute. I mean, you don't really have a risk. I mean, I'm in the UK. Someone was saying on Facebook or something, should I visit the UK because you've got a case there? It's not like that at all. And people say, should I go to such and such a city because there's a case there? These cases, these known cases, then they're quarantined and looked after, and all their contacts, the close contacts have been chased, and they're the ones who are at risk. And if you haven't had someone come and knock on your door and say, watch out, there's someone from Wuhan and you've had close contact with them and we're keeping an eye on you, then it's your chance is about 0. But it is good to wash your hands a lot and try not to touch your face too much during the day if you're trying to protect you from after touching surfaces that other people could have infected people have touched. If it's clean, if it's been washed recently, it's absolutely safe. If nobody's touched it since it was washed, because it's very easily destroyed, this virus. The virus, and just a little bit about how it works in the human body. And viruses can survive for a long time in the human body before you get symptoms. The reason is because it's growing. It starts with a little colony and then it doubles, and then it doubles, and then it doubles again. The virus is increasing, and all through all the cells, and the cells just produce lots of virus for other cells. And it hijacks the biology of a cell to produce more viruses, which then spread from cell to cell. And then it's when that gradually spreads to lots of cells throughout your body. So for between 2 days and 14 days, it's just increasing very, very slowly. But it's doubling time. It's doing this sort of thing, very, very slowly, and then up and up and up, and then more like a proper exponential. Then you get your symptoms when it's way up there somewhere. Now, if you have a virus on a parcel, say, so people are scared of a parcel from China, then it's not going to survive long at all, because it needs to find a host to replicate it. And there are some viruses that can survive a long time outside the body, but these are not the type that do that. So you're absolutely safe with a parcel from China, say, unless you've got such speedy, you're so close to China, it's so speedy, you get within hours. I don't think that's true of anyone. So don't worry about parcels from China. And yeah, that's about it. So anyway, if you want to help with fact checking, then we've got our Facebook group, Doomsday Debunk. We do stuff like this. We do it with science-based evidence fact checking. That's what we're looking for, especially if you're very good at doing research and finding reliable sources. In this case, it's the science, the WHO. You get the idea from this video. Or if you're very scared, or if you're good at reassuring people who are scared, and just helping them get through their fear and their panics. And if you're a scared person yourself and you want help, do join our Facebook group and do check the rules at the head of the group, which is what makes everyone, which helps make it run smoothly. And what we're looking for are people who are actually scared. We're not looking for people to go around the web sort of scouring it for things for us to debunk. We're looking for something that you're actually scared of, and you come to the group and say, "Oh, I'm terrified of this, can you help us?" And no matter how silly it is, then and even if you know it's silly, just still let us know, and we'll do what we can to help, in partnership with health professionals, of course. What I mean is the no health professional. We're not a health professional based group at all, but we help people, and we always say, go and if you're having serious panics and depression and post-traumatic stress disorder type symptoms and so on, then your health professionals can do an awful lot to help you with that. And it's been no surprise if some people have suicidal feelings, and again, there's a lot they can do to help. And it'd be no surprise if some of you who've watched this have been triggered in that way, because especially the way the media make it seem so absolutely scary. Remember, if they talk about the epidemics in the past, 1918 Spanish flu, remember that they had hardly any medicine of what we call medicine back then. They tried to treat it with large doses of aspirin. They thought that they could stop a virus with aspirin, large amounts of aspirin. It didn't work, and it led some people to have aspirin poisoning. And that was one of the cures that they tried for the Spanish flu. Just one. I don't know how many people actually died of aspirin poisoning, but they certainly, it wouldn't have. Some of the symptoms apparently of some people who are very ill were a little bit like that. There's a controversy about that, whether that's true, but certainly they did. That was the advice that was given: is just give your patients vast amounts of aspirin. I mean, you wouldn't get that advice now because it does nothing. It just makes them ill. If it does anything, and they just hadn't a clue. It was before penicillin, because often if you get complications of microbial pneumonia, because the pneumonia they have is viral pneumonia, kind of irritation of your lungs from the viruses, but it can aggravate and lead to microbial pneumonia, and they didn't have anything to deal with that back then, no antibiotics. So it's not, if it did become a pandemic, it wouldn't be like the Spanish flu, because people would know how to treat it, and sooner or later we're going to have a vaccine for it. And the main concern is in Africa, and if it did become a pandemic, then you could have tens of thousands of people die in Africa before we begin to get it under control. And that is what all our eyes should be on that. And what can we do to make sure that it doesn't get into Africa? It's far more important to the UK to stop the coronavirus getting into Africa than to stop the coronavirus getting into the UK, even through pure personal self-interest. We shouldn't be, it's saying you should evacuate 30,000 people from China. that's not our priority. I don't really understand the point in that advice. You should advise them to protect themselves in China, but then, that's certainly not our priority. The priority should be, what can we do to stop it getting into Africa and South America as well. South America can contain initial outbreaks, but if it starts spreading through rural areas of South America, it'll be the same thing. Very, very difficult to contain. So this is where the focus is, and they asked for $625 million. They got it. They haven't got it yet. They got $100 million of it already. So I expect they'll get it, and certainly a good start to get it started of what they need. Anyway, so I hope this was helpful and help some of you be a little bit less scared of this, and just be, always, whatever happens, you're going to have these conspiracy theory people who are going to be saying all sorts of dire and very silly things, and they're always going to claim to know more than the experts know, and to have background information. Sometimes they make stories up, sometimes they have some genuine connection, but they pick it up and think that this means that they know everything. So, and this video is bound to be full of mistakes in it, so if you notice anything I've got wrong, do correct me. I've explained as best I can based on the sources I have. I am not an expert in this myself. I'm just telling you what I've read and what I've heard, and I strongly recommend you listen to the WHO on Facebook, and listen to their regular people, and they'll have these sources, and I'll put that. Do join our Facebook group if you need help with this sort of thing. And I've said all that, I think. Yes, I just went on to the digression at the end.